Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. Hi, it's Dr. again, and we are here for the Endo Kids podcast. We are going to talk today about growth in kids. So growth concerns, when your height and weight for your child is not on track. I'm here with Dr. Waldman today, who is my co-host. And Dr. Waldman, one of the most common questions we hear from parents is my child growing normally? So what do you have to say for that?
Absolutely. Growth is probably one of the most important things that we talk about and that we see as pediatric endocrinologists. It's a visible sign, but it really tells us what's going on inside, if that makes sense. We should understand what's normal to understand what isn't normal. So today we're going to talk about things like growth charts, red flags, common causes of growth problems, what to expect at an evaluation in case you do take your child in for growth concerns, and we'll try to end it with some tips for healthy growth, things that you can do at home.
Yeah, one of the things that I talk to about patients in the clinic all the time is understanding growth charts. And a lot of people don't understand the growth charts. One of the common questions I often get is, my child was big as a baby, and they were like 9 pounds and 21 inches when they were born. And then now they have dropped to the 25th percentile. And we're going to talk about that. But I do want to start talking about percentile. So when you talk about percentiles on the growth chart, what does that mean, Dr. Waldman? What do you tell patients about the percentiles?
Absolutely. So percentiles are really just a way to compare your child's height and weight to other kids that are exactly the same age and, of course, the same sex. If your child is on the 25th percentile, that means that out of 100 kids, 75 out of 100 are taller. I also think it's really important to understand that percentiles are not good or bad. That's really important for parents to understand as well as kids to understand. Sometimes we think of these numbers as grades, and they are not grades. They are facts. They're not good, they're not bad, they're just information. We want your child to follow their own percentile, whether it's at the fifth or the 95th. Again, one is not better than the other. It is just important to understand that we want them to follow what is, quote, normal for them. And when we say normal, what do we mean, Dr. Mara?
Yeah, so really, again, like you said, it's consistency. So oftentimes we'll look and say, okay, your child was a bigger baby, but let's look at genetics and let's look at where they were. And usually I tell patients after the age of 3 is when I really start to look and see what percentile they're on. If they are following the 25th percentile for height, and that's consistent for several years, then for me, I would consider that's normal. And most pediatricians say, okay, that's normal. So if they're following along the 25th percentile over time until they hit puberty, that's usually pretty normal. But if they drop from, say, the 50th percentile over that time, so from 3 till they hit puberty around 10 for girls or 11 or 12 for boys, if they start dropping down to the 10th percentile, that's a red flag. And that's something that parents really need to ask for help. So usually if that height falls across 2 or more percentile lines, I start to worry. And then growth that slows dramatically compared to their peers, Again, we talked about puberty before, but puberty that starts too early, we talk about growth percentiles. So if growth percentiles drop, that's abnormal. But if growth percentiles rise, so say they started at the 10th percentile, but all of a sudden they're going up to the 25th or 50th percentile around the age of 6 or 7, that's a red flag that we need to look at. And then if they're gaining weight, but dropping in height percentiles, that's a reason that they need to be evaluated by a pediatric endocrinologist. And then if they have other signs or symptoms, like they have stomach pain or frequent illnesses and they're just not growing well, that's another sign too. So something feels off also for parents, that matters.
Absolutely. And we mentioned on some of our earlier podcast episodes that parents know their kids. We trust parents, we listen to parents. That's how I think both of us like to practice when we see our own patients. And if you feel like something is off, something is not normal for your child, we should look into it. We should understand your concern and then hopefully find a way to explain what's going on.
Yeah, Dr. Waldman, if a child is not growing well, what could be going on? What are the categories that you think about as far as causes of growth concerns?
Absolutely. So there's a few different major categories. The first one, of course, that I'll talk about is hormones. As a pediatric endocrinologist, that is what we deal with. And issues with almost any hormone in the body can cause problems with growth, especially issues with the thyroid, the pituitary gland, or, of course, growth hormone. The second big category is genetics. Some kids inherit short stature from their parents, but there also can be other conditions that go along with short stature, like something like Turner syndrome. The third category is nutrition. I had mentioned in previous podcast episodes that my background is in nutrition. I'm actually a registered dietitian, and nutrition is so important for everything, but especially for growth. So, if kids have a poor diet or they're deficient in something such as maybe iron, or even conditions like undiagnosed celiac disease, that can cause poor growth. And I think the last category would be chronic illnesses. Asthma, kidney disease, other inflammatory conditions can cause problems with growth. Did I miss anything?
No, I think you hit all of them. And so growth problems aren't always just hormones, like you said. Sometimes it is nutrition, sometimes there are medical conditions, and sometimes it's genetics. It's hard to piece that together. But we have been doing this for a long time. So we look at this, and when we evaluate your child, and when we see our patients in the clinic, we really look at all these broad categories to say, first of all, is their growth pattern normal? And we often explain that in the clinic and show patients where are they on the growth chart? Where have they been? And then if there is a reason to be concerned, we will do an evaluation. The next question I get from patients often who are coming to see us is, what happens? So they bring their child to see us in a pediatric endocrinology visit, and what happens? And what we really look at is we look at the growth charts and the family growth pattern. So we will often ask you, what is your height? What is the mom's height? What is dad's height? Are there genetic conditions in the family that would affect growth? The other piece is there somebody in the family who was a late bloomer? And oftentimes, I don't know about you, Dr. Waldman, but I see oftentimes that boys in particular, when their dads went through puberty late, I often see the same thing in the boys, that they also go through puberty a little bit later and they may have a little bit later pubertal start and then they grow a little bit longer. But we do ask for that. The history is a major piece of the puzzle. Then we talk about blood tests. So we'll check thyroid, growth factors, nutrition, and sometimes genetics. And then the next thing that we usually do is ask for a bone age. And Dr. Waldman, do you want to talk a little bit about a bone age and what that is?
Bone age is an x-ray. I get the question all the time, what is a bone age? What does it mean? It's very simple. It's an x-ray, usually of the left hand and wrist, and it helps to show us how mature or how old the bones are, and we compare it to the child's chronologic age. Sometimes the bones are exactly the same as the chronologic age. Sometimes they're a little bit older, sometimes they're a little bit younger. And really, what that gives us is the time frame in which the child has to grow. So girls grow until a bone age of 14, boys grow until a bone age of 16. Again, remember, this is not their chronologic age, this is their bone age. So it gives us a window of time. Everyone talks about that quote, window of time you have for growth, and it tells us how long you have to grow. That helps us when we look at the full picture. Like Dr. Mehra said, we put it together with the long history that we take, the physical exam, and maybe even the blood work that we did, so we can get a good picture of what's going on.
Yeah. So, for an example, that bone age that we take, say you have a 10-year-old and that we do a bone age and it shows that they have the bones of an 8-year-old. Like Dr. Waldman said, girls typically grow until they have a bone age of 14. So for that child, instead of growing until their chronological age is 14, they may keep growing until they're 16. The other thing I wanted to point out, and I want to ask Dr. Waldman your opinion about this or what you hear, what you say to patients, because I get this all the time, is I have somebody come in the office and they say their bone age for a boy is 16. And they say, we heard that boys grow until they're 18 or 21. Why are you telling me that my child's bone age is 16 and that their growth is complete? So what do you usually say to those parents?
This is a really hard question and a hard thing to talk about sometimes. But again, as pediatric endocrinologists, we know that the major substantial growth really is done when the bone age is 16. Yes, you may have had a nephew, a best friend, an uncle that grew until they were a chronologic age of 18, 21, all of those things. But that just means that their bone age was delayed. We don't know what their bone age was at that time. And so when we see patients where their bone age has already closed, unfortunately, as pediatric endocrinologists, there is really nothing that we can do as far as medications to help their growth. What is important is keeping them healthy, right? So, good nutrition, good sleep, physical activity, those are always very important. But unfortunately, there's really nothing that we can do medically that's going to change their growth and height. Do you say the same thing, Dr. Mara?
Yeah, I say the same thing. I get a lot of other questions too. One of the other questions I get is, is there a particular type of exercise that will help my child grow more? For example, will hanging on the monkey bars help them grow taller? So what would be your response to that?
I tell them that there is nothing specific. They should do what they enjoy because I always believe if you enjoy the exercise, you'll do it more. And we know that's very important lifelong. But unfortunately, hanging on monkey bars versus playing soccer versus going to karate, nothing is going to change your growth. But that being said, physical activity is so important. I believe it's important for our physical health, but I also really think it's important for our mental health. I know it's important for my mental health. I am a better, nicer person when I'm able to get some physical activity.
Yeah, parents often fear when they come to us that it's automatic medication, but sometimes the best plan really is just watchful waiting with good nutrition and regular check-ins. I think both of us really have gotten really accustomed to looking at growth charts, and we look at growth charts with a fine-tooth comb, at least I do, because if I notice like a big drop in their height or an increase in height, I will talk about maybe we need to do something else, but it's not always the case. And sometimes it's just watchful waiting. And I've had patients get mad at me and say, like, why do you want us to wait 6 months to see if my child's not going to grow? Because they're already not growing, they're already shorter than their peers. And usually it does take time for kids to grow. I always tell parents that sometimes kids grow faster in the summer than they do the winter, or sometimes if we change things with their diet, it can help. So if we balance their nutrition, increase their eating, their calories, have increased protein, whole grains, fruits, veggies, we really focus on sleep, and kids do grow during deep sleep. So it is important for them to get enough sleep. Physical activity, like you said, really helps growth hormone be released and helps kids grow. And then staying on top of the growth charts. So at the first visit, I don't often tell patients that their child needs growth hormone, we really need to look at it over time and what's happening and what their growth looks like. I don't know if you do the same thing, Dr. Waldman.
Absolutely. Sometimes it can be very frustrating for patients or for families because, like you said, growth does take time. We need to see if things change over time, where they're going. But I think when you do see a pediatric endocrinologist, when you have regular check ins, you know someone is watching. And if something is wrong, if there is intervention that is needed, someone will intervene. So I think that's really important. The other thing that I think is extremely is important is not comparing yourself or your child to other kids. And that is one of the hardest things. And I'm saying that as a parent, of course. It is really hard not to compare where they are in the height order. But every child is different, every family is different. It is really important for your child to know what is inside that matters. It's not necessarily their height. We want them to be healthy. That is the most important thing overall. To grow normally for them, that is going to be very different for each patient that we see because of their genetics, because of everything that makes them unique. So I think that's one of the other things that we both stress. Every child is unique. Please don't compare. Health is most important.
Yeah, and I think that's very important just to emphasize is that every child is unique and every child deserves to have that evaluation by the pediatrician, by their pediatric endocrinologist. As a parent, if you're concerned, it's always better to get your questions answered rather than losing sleep over it. We're always here to answer your questions. If you have other questions, we'd love to hear from you and send us a message on Instagram or TikTok or on our website. Information is linked in the show notes, and so you can send us your questions as well. But thank you so much for joining us for this episode. And remember, every child grows at their own pace, but if something feels off, it's really always worth asking.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.